Good morning, everyone. Today is Tuesday, June 17th, 2025. I'm Dr. Smalls, Director of Professional Development for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to today's Waiver Amendments 2025 webinar, where the focus is on the waiver application overview and inputs process. Before beginning, we want to ensure civility for all meetings. The free expression of diverse viewpoints is an essential value for our group. This freedom comes with the responsibility to engage respectfully, which involves treating one another with dignity and respect in good faith. Uncivil behavior, disruptive conduct, abusive language, threats, or harassment will not be tolerated and may lead to being excused from the meeting. If you would like to use closed captioning so that you can read what is being said, click this button. Sometimes the transcription is not exact, but it's pretty close. Today's presentation is available in the handout section. Click here where you see the paperclip to download the presentation slide deck. All attendees are currently in listen-only mode, and your mics and cameras are turned off. If you have a question that you'd like us to read and answer, click here where you see the question mark to add your question to the chat box. And now I'd like to turn the mic over to Robert White. Good morning, Robert.
Good morning, Dr. Smalls, and thank you. And good morning, everyone, and thank you for joining us today as we discuss important updates regarding the Developmental Disabilities Administration's Medicaid Waiver Amendment application and input process for 2025. This is meant to build on the presentation that we did yesterday that went more into detail about what is being included in the 2025 waiver application. My name is Robert White, and I am the Chief Operating Officer for the Developmental Disabilities Administration. First and foremost, I would like to emphasize that your participation and input are crucial to ensuring that our waiver programs effectively support individuals and families across Maryland. So in today's session, we'll do a few things. First, we'll walk through significant amendments aimed at creating a single streamlined Medicaid waiver, the Community Pathways Waiver. This single waiver will simplify service delivery, enhance efficiency, and provide equitable access to all essential services, including meaningful day activities, residential supports, and other individualized supports. Next, we'll also review the fiscal year 2026 budget bill and the Budget Reconciliation and Financing Act of 2025 requirements passed by the General Assembly. This bill requires an amendment to the waiver and is part of the application. The application also includes the updates made by CMS to the Individual Family Directed Goods and Services Technical Guide. It is important to note that many of the changes you will hear about this morning and heard about yesterday if you attended that session will go into effect on October 6th, 2025. And you will have until July 8th to provide your feedback and suggestions for consideration. We have heard your questions and concerns and will dedicate time after the briefing for you to provide constructive feedback and ask questions. So this morning's session is scheduled for 90 minutes so that we leave about 30 minutes for you all to ask questions and to address any questions or comments that we receive. Your perspectives and experiences are essential to shaping these services. We are committed to engaging with you and listening to your insights and ensuring that our waiver services meet the evolving needs of our community. In addition to this briefing, we will host 2 additional briefings for you to engage and provide feedback today. Another session devoted to the self-direction model will occur this afternoon from 12 to 2 p.m. And then we'll conclude with a session dedicated to services and provider qualifications from 2:30 to 4:30 p.m. this afternoon. All sessions will be recorded and posted on DDA's website. And again, the formal public comment period started last Monday, June 9th, and will continue through July 8th. And I want to emphasize the importance of the public comment period to give as many people as possible a chance to participate in the process. With this collaborative spirit in mind, let's begin today's session. Joining me today are Rhonda Workman, Director of Federal Programs, and her Deputy Director, Nova Evans. Rhonda, how are you doing today?
Good morning, Robert. Thank you. And good morning, everyone. Thank you for joining us today. Can you go to the next slide, please, Dr. Smalls? Today, we will be sharing information related to the 2025 DDA-Operated Medicaid Waiver Program amendments, specifically the application overview and the input process. As Robert shared, my name is Rhonda Workman. I'm the DDA Director of Federal Programs. We're going to begin by sharing a brief overview of our programs that we operate on behalf of Maryland Medicaid. As Robert mentioned, we will also share information related to the amendment requirements associated with the legislative fiscal year 2020-26 budget and the Budget Reconciliation and Finance Act. We will also review some program challenges and strategies that we have to address them. We will share an overview of the federal Medicaid waiver application and how it is organized. We will share information related to the topics or the appendices. We will then close by sharing information regarding the public input process and the additional stakeholder engagements that Robert just mentioned. Please note, we have created a dedicated DDA amendment webpage that includes track change documents of our proposals for your review and input. For more detailed information regarding the current standards and the current approved waiver, please refer to that specific federal program application, any associated regulations, policies, and guidance. Before we begin, we also want to make sure and remind you that DDA staff are always available to provide assistance and answer questions. Next slide, please.
Good morning, everyone. My name is Nova Evans. We will start today's presentation by providing an overview of what a Medicaid waiver is and the DDA-operated waivers as per the currently approved by Center for Medicare and Medicaid Services waiver applications. Next slide, please. So what is a Medicaid waiver? A Medicaid waiver is a federal medical assistance, also known as Medicaid, program. Waiver means that some of the regular Medicaid rules are quote-unquote waived. That means they're not applied. Waivers are typically intended to give states flexibility to serve specific populations and provider services in innovative ways and to avoid institutionalization. Waiver programs are approved for a 5-year period and then must be renewed. An amendment can happen at any time if needed. The DDA currently operates 3 Medicaid waiver programs on behalf of the department. This presentation will talk about the upcoming waiver amendment. As you can see here, the 3 DDA-operated Medicaid waivers currently include the Family Supports, Community Supports, and Community Pathways waivers. Each has a different eligibility requirements and access to different services. The 3 waivers collectively offer 52 services in total through 2 different delivery systems. The community provider managed, also known as traditional model, and the self-directed services model, where the person serves as the employer of record. Next slide, please. So this slide notes meaningful day services offered through the waiver. These are employment services, career exploration, supported employment, community development services, day habilitation, and medical daycare. These are currently available to participants in the Community Supports and Community Pathways waivers. Next slide, please. This slide notes the various support services offered through the waiver. Most of these services are currently available to participants in all three waivers, meaning the Family Supports, Community Supports, and Community Pathways waivers. These support services, as you can see on this slide, include assistive technology, behavioral support services, environmental assessment and environmental modification, family and peer mentoring supports, family caregiver training and advocacy supports, individual and family-directed goods and services, housing support services, live-in caregiver supports, nursing support services, participant education training and advocacy supports, personal support services, remote support services, respite care, support broker services, transition services, transportation services, and vehicle modifications. Next slide, please. This slide notes the various residential services offered through the waiver. These are currently available to participants in the Community Pathways waiver only. And these include community living group home, community living enhanced supports, shared living, and supported living. Next slide, please.
Thank you, Nova. Now let's review the budget bill and program challenges. Next slide, please. The fiscal year 2026 budget bill and the Budget Reconciliation and Finance Act of 2025 requires amendments to address cost containment strategies. This includes updating dedicated hour rates, specifically changing the rate for residential dedicated supports from 87% to 86% of the fully loaded brick or the fully loaded rate. It includes updating geographical differential rates for services. Specifically, geographical differential rates are used for Calvert, Charles, Frederick, Montgomery, and Prince George's counties. The budget bill also includes creating a new day-to-day administrative support waiver service and updating the individual and family-directed goods and services by establishing a limit. Next slide, please. We would also like to address challenges that the state and stakeholders have identified in this amendment. Operating 3 Medicaid waiver programs for individuals with developmental disabilities is not efficient, creates confusion among stakeholders, requires duplicative processes, reports, and impacts staff resources. Creating one program will help to decrease overall volume of applications to the Eligibility Determination Division, or EDD, addressing stakeholder concerns with delays, unresponsiveness, etc. Decrease waiver application packets for coordinators of community services. Decrease person-centered plans for review by the DDA regional office, and speed up participant enrollment. Currently, individuals' needs that can no longer be met in their approved Medicaid waiver program have to disenroll from that program and complete a new waiver application process to receive services. New applications and delays in processing can impact enrollment and access to services to support health and safety needs. Creating one program will support immediate need to access services and address new health and welfare needs. As discussed during the legislative session, there are several concerns related to the sustainability of the DDA-operated Medicaid waiver programs. Costs for services, such as dedicated hours, self-directed service utilization, and other factors, are growing at a faster rate, impacting sustainability of the program and impacting the federal cost neutrality requirements. We will continue to work with all stakeholders, including legislators, on program sustainability strategies over the next year. As needed, additional amendment proposals can be considered in the near future. Next slide, please. So now we'd like to share a brief overview of the amendment. Next slide, please. The amendment vision is for a comprehensive and sustainable Medicaid waiver program. This includes actions taken to inspect and review program and recommend better designs. It includes updating service definitions with the Budget Reconciliation and Finance Act requirements and for program sustainability, and consolidation of the DDA-operated Medicaid waiver programs so that all participants can access needed services. Today, we're going to share a brief overview of the waiver application and the public input process. And again, we will have and will continue to engage with stakeholders. Next slide, please. The purpose of our amendment, as noted in the documents that we have shared, includes to streamline and enhance the service delivery by merging the waivers into a single comprehensive program, all under the Community Pathways waiver. By merging the three programs, all participants will have access to the full array of support services, meaningful day services, and residential services based on the assessed needs. This will improve efficiency, ensure equitable access, provide a more person-centered approach to supports, and increase timely access to services. Having one program will also reduce the duplicative processes currently impacting staff resources with the Eligibility Determination Division, regional offices, financial management counseling service providers, and coordinators of community services. Next slide, please. Our amendment purpose will also ensure greater transparency, streamline service delivery, ensure funding is outcome-driven and sustainable, meet federal assurances, and reinforce regulatory compliance within the Medicaid waiver program for both service delivery models. This includes reducing the risk of federal audits and recoupment from audits that are under or could be under the new federal administration. Next slide, please. We have also incorporated and clarified program standards and requirements. This includes in-person health, welfare, and service monitoring visits. It also includes incorporating policy standards such as meaningful day services, training, and competitive integrative employment requirements. We want to be transparent about the service opportunities and standards. We have updated our service descriptions to better clarify terms and scope. For example, we have streamlined the support broker description and scope using information from the updated Center for Medicare and Medicaid Services Technical Guide. With the consolidation of the waivers, we can establish one set of regulations versus 3 separate regulations, which would be required for each of our programs. One set of regulations will help to reduce complexity duplication, and confusion among all stakeholders. We will also seek to create and seek stakeholder input on user-friendly manuals, noted in plain language, similar to our collaborative effort around the Guide to Services. Next slide, please. This slide is a visual of the Medicaid waiver consolidation. You see that we have noted the Community Supports Waiver, the Family Supports Waiver, and the Community Pathways Waiver would all be consolidated all under one waiver program, the Community Pathways Waiver. Next slide, please. I'm going to now turn it over to Nova to share an overview of the waiver application.
Thank you, Rhonda. Can you go to the next slide, please? So this slide shows an overview of the structure of Medicaid waiver program applications. Each application includes specific appendices, like chapters in a book, that contain required information and/or options for states to consider. And you can see these listed here. Appendix A, Waiver Administration and Operation. This appendix outlines the state's responsibilities for managing and overseeing the waiver program. It details the roles of different state agencies and how they ensure compliance with the federal Medicaid requirements. Appendix B, Participant Access and Eligibility. This appendix outlines the state's responsibilities for determining participant eligibility and ensuring equitable access to waiver services. Appendix C, Participant Services. This appendix outlines the state's responsibilities regarding participant services and service planning. It describes the type of services available, the criteria for those services, and how they are delivered to meet the needs of each participant. Appendix D, Participant-Centered Planning and Service Delivery. This appendix outlines the state's responsibilities for ensuring that waiver participants receive services based on a person-centered planning process. This process ensures that individuals have a say in their care and receive services tailored to their needs, goals, and preferences. Appendix E, Participant Direction of Services. This appendix outlines the state's responsibilities when waiver participants are given the option to self-direct their services. Appendix F, Participant Rights. This appendix outlines the state's responsibilities to ensure that waiver participants' rights are protected and that they are safeguarded from abuse, neglect, and exploitation. Appendix G, Participant Safeguards. This appendix outlines the state's responsibilities for ensuring participant safety and service continuity during emergencies, disasters, or other disruptions. Appendix H, Systems Improvement. This appendix outlines how the state ensures compliance with federal requirements, monitors service delivery, and improves the quality of services for waiver participants. The state must implement a quality improvement strategy to monitor and enhance waiver services. Appendix I, Financial Accountability. This appendix outlines the financial accountability responsibilities of the state. It details how the state ensures proper financial management. It discusses rate settings methodologies, billing and payment procedures, and financial safeguards. Appendix J, Cost Neutrality Demonstration. This appendix outlines how the state demonstrates that the waiver is cost neutral during each year. The state must ensure that the waiver does not cost more than institutional care over the life of the program. So throughout this presentation, we will go through the appendices and share some proposed updates. Please see the track change proposed waiver amendments for additional information, as not all the changes will be discussed. This is going to be a high-level conversation. So for additional information regarding the proposed amendment, please also review the June 16th, 2025 recorded webinar regarding the amendment that covers the waiver appendices. Next slide, please.
Thank you, Nova. Appreciate that. And again, this webinar is specifically just providing you that kind of organization or framework for the Medicaid waiver application. For detailed information about those various appendices, please refer to our webinar yesterday. Join us for the next webinar related to self-direction, or the one this afternoon that will go through Appendix C, services and provider qualifications. Now we're going to touch base and review the stakeholder engagement and public comment period. Next slide, please. This slide includes the various stakeholder engagement and dates and topics. Yesterday, we shared an overview, a detailed overview of the entire waiver application and proposals. We are now reviewing the waiver application overview and the input process. As Robert shared in his opening, at 12 o'clock, we will also provide additional information and review things related to self-direction, including participant services in Appendix C that are self-directed, Appendix E, which is participant-directed services. And then later today at 2:30, we will review services and provider qualifications. We hope you're able to join us for those additional discussions. The formal comment period began on June 9th, 2025, and goes through July 8th, 2025. Next slide, please. This slide includes the additional information regarding the public comment process. As I mentioned, the public comment period is from June 9th, 2025 through July 8th, 2025. We have shared track change documents that are posted on the DDA website that are related to all the various appendices and the various services for which we propose changes. Your public comments can be submitted to us in two ways. First, you may submit to a dedicated email address at wfb.dda@maryland.gov, or you can mail to DDA Federal Programs at 201 West Preston Street, 4th floor, Baltimore, Maryland 21201. To be considered, all public comments must be received and submitted by 11:59 p.m. on July 8th, 2025. Next slide, please. Now we're going to open up for the questions that we have. Dr. Smalls, if you could assist with going through the questions, we're happy to answer.
Okay, great. So our first question is, will people in the family supports and community supports waiver have to redo their waivers prior to October, or will those waivers automatically transition these people into CPW?
It's a great question. Individuals who are currently enrolled in the family supports and community supports waiver will automatically be transitioned under the Community Pathways program. There will be no action needed by the individual, the coordinator of community services. Their services and their plans will be updated to reflect the Community Pathways waiver program.
Thanks, Rhonda. Next question, will the consolidation of the waivers change the process for applying for a DDA waiver?
No, the consolidation of the waiver programs will not change the process for applying for a DDA waiver. Instead of having 3 waiver programs to apply or transition to, we'll only have 1 waiver, and the process will remain as it is today.
Thank you. Will dedicated hours be approved for people who are retired from meaningful day supports?
Yes.
Okay. Will dedicated hours be approved for people that require significant support for their ADLs, eating, drinking, toileting, safe ambulation in their communities?
Dedicated supports will be reviewed and approved for individuals as outlined in the approved Medicaid waiver program application. The requirement would be for a behavior support plan or nursing care plan demonstrating the assessed need. DDA also currently has a policy related to dedicated hours being authorized when individuals are retired or within transition. Those standards are currently in place and will continue.
Thanks, Rhonda. If the waiver amendment proposals are all approved and implemented on 10/6, will people currently enrolled in CSW and FSW automatically update to CPW?
Yes, we will. We have worked with our information technology systems and have a strategy and plan in place that will automatically update the program enrollment for individuals to all be transitioned to the Community Pathways waiver.
Thanks, Rhonda. Is DDA required to share public comments with CMS when the waiver amendment is submitted?
Yes, so the process will be is we will summarize the public comments that we receive. The summary will be included in the waiver amendment in the Appendix A main section. There is a specific area that's noted in the federal application for public input. We will summarize our process to include these webinars, and we will summarize the input we received. In addition, the DDA will post to the dedicated amendment page a summary of input that we received for the waiver amendment.
If you're already a Community Pathways recipient, is there anything else that needs to be done?
No, there will be no action needed for the Community Pathways participants.
Will merging the waivers make it more efficient for EDD to approve waivers and redeterminations?
We believe that merging the waivers, as we've shared, will reduce the impact and duplication of processes and work demand on our various partners, including the Eligibility Determination Division, or EDD, our coordinators of community services, or CCSs, our regional offices, and also the financial management and counseling services providers.
Okay, thank you, Rhonda. In addition to the current quarterly monitoring visits conducted by the CCS, who will be providing additional monitoring visits? How frequently will those visits happen? And how will the monitors be trained in how to conduct the visits?
Yeah, that's a great question. As we shared yesterday, we are seeking to increase safeguards and monitoring. That would include monitoring and visits from our DDA regional office staff, to include our staff that are associated with our quality enhancement units. This team reviews incidents that are submitted and then conducts follow-up. We also have regional office nurses and quality enhancement nurses that also follow up and do monitoring related to more health and medically related concerns, complaints, and incidents. We also shared yesterday the Office of Healthcare Quality We'll also be conducting monitoring and follow-up related to incidents and complaints. So those are some additional ones in addition to our coordinators of community services that conduct the quarterly monitoring and visits and more frequently as needed.
Thank you. Will our current residential waiver redetermination dates be affected by the merging of all services into the Community Pathways waiver?
Redetermination dates for individuals in family supports and community supports and the Community Pathways waiver will not change. We're just updating their enrollment program if you're in family supports or community supports.
Thank you. Will one-to-one services be eliminated?
No, currently in the programs and will continue in our proposal is dedicated supports for one-to-one and two-to-one may be authorized based on assessed need and meeting the requirements in the waiver program and policy.
Thanks. What does it mean that the state program expenditures under the proposed single waiver cost no more than institutional care?
It's a good question. So yesterday we shared information related to a requirement in the federal program for what's called cost neutrality. Cost neutrality basically means that the cost for services for participants in the Medicaid waiver programs cannot cost more or exceed the cost for providing supports in an institutional setting. For the DDA-operated Medicaid waiver programs, our institutional setting is referred to as an intermediate care facility for individuals with intellectual and developmental disabilities. For the state of Maryland, we use our state residential centers, which are the Holly Center and the Potomac Center, to use as our institutional standard. So for cost neutrality, we have to look at the cost associated with direct supports for an individual residing in the Holly Center or Potomac Center and any Medicaid related costs such as doctors, pharmacy, specialists. And we have to compare that to the cost of our home and community-based waiver services for the waiver participants, plus their Medicaid direct costs such as doctors, pharmacy, and specialists. So you look at those two numbers and we have to make sure that our waiver program services are less than the cost of the institutional costs for Holly and Potomac centers.
Thanks, Rhonda. If someone has a current waiver that was approved in 2023, will that be valid until 2028 under the new regulations so they won't have to reapply in 2028 until 2028?
Yeah, so that's an interesting question. So when you apply and enroll in a Medicaid waiver program, you must initially and continuously meet the eligibility requirements. There are technical requirements, financial requirements, and medical requirements. So when you enroll in a program, you have to meet them initially and then annually. So annually we do a person-centered plan. Annually we reassess your level of care. And for some individuals, they have to redo their financial redetermination. So as long as you continue to meet the eligibility standards, you will continue to be enrolled in the program. The question, though, makes me think that they're not talking about waiver participants, that they may be referring to the waiver program. So a waiver program in general, not participants, but the state and federal arrangement and approval of a waiver program is good for a 5-year period. We shared yesterday the DDA-operated Medicaid waiver programs will begin its 3rd year of a 5-year approval from the federal government on July 1st, 2025.
Thank you. Will self-directed services be eliminated? How does this affect self-directed services?
Self-directed services, or the self-directed service delivery model, will not be eliminated in our proposal. We will be sharing additional information at our next webinar, but the services will continue. And we shared an overview yesterday related to the various components of the waiver application, but services for self-direction will continue.
Will providers be required to update their program service plans to reflect the consolidation of the waiver program?
It's a great question. The majority of the providers are already enrolled and provide supports under all three DDA-operated Medicaid waiver programs. Therefore, they will not need to make any changes. There are probably less than 10, maybe about 5 providers who are not current participating in the Community Pathways waiver. So we have a strategy to follow up with them and support them in their effort to be fully enrolled and engaged under the Community Pathways waiver if they choose to continue to provide services. If providers would like to enhance their service business model, such as maybe now offering virtual supports, they should reach out to the regional office, provider services team, and update their program support plan to include virtual supports and any other updates to their business model.
Thank you. How does merging the 3 waivers decrease the number of PCPs needing to be reviewed?
Yep, that's a great question. As we shared, when individuals will need their needs change and they would then need to disenroll from their current program and apply to another Medicaid program to meet their needs, another person-centered plan and an entire Medicaid waiver application packet and process must be completed. By merging the waivers, these additional person-centered plans and Medicaid waiver application packets and processes will no longer be needed.
Thank you. The DDA sent an email inviting public input on June 16th, which says the amendments have been open for public commentary on the 9th of June. Why did we send it? Why did we not send something before June 9th?
Yeah, the DDA actually sent out communications on June 9th to stakeholders announcing the opening of the public input period. We conducted a webinar yesterday, which was noted in that announcement on June 9th, along with these additional webinars that we're doing today. Yesterday, we sent an additional communication to remind individuals and to encourage them to register and participate in these additional webinars today. So the initial communication did go out on June 9th.
Thank you, Rhonda. From yesterday's presentation, could you please clarify what you meant by remove day trips under transportation? Does this change affect standalone transportation
Yes,
in the community?
Yes, thank you, Dr. Smalls. So under the transportation standalone service, we shared that transportation is related to supports in the individual's community. And we shared our proposal is to remove day trip day trip standards. So this would be individuals going from Western Maryland all the way to the Eastern Shore as a day trip. We will continue to support standalone transportation supports for individuals in their communities, such as their grocery store, places of faith, groceries, banks, libraries, etc.
Thanks. The email also provides a link to a dedicated website explaining the amendments, which only contains amendments for the Community Pathways waiver. Does this mean you are only proposing amendments to CPW?
That's a great question. What we're proposing is the consolidation of the 3 DDA-operated Medicaid waiver programs. So the Family Supports Waiver, the Community Supports Waiver, and the Community Pathways Waiver. They will be all consolidated under the Community Pathways Waiver. We've included all information about the proposed changes on the dedicated the dedicated website under Community Pathways, which is our proposal for the consolidation. So you'll find all that as a single point for all stakeholders to be able to view all the proposed changes and how we would have one waiver program instead of 3.
Thanks. If you are proposing amendments to self-directed services, where are they on that website?
So self-directed services are incorporated in the specific service descriptions. So participant services, or Appendix C, includes all DDA services. Nova shared them a list of those today in this presentation, which included our meaningful day services, our support services, and residential services. Of those 54 services that she referenced, there are specific services that have been designated to be self-directed services, meaning an individual who chooses the self-directed service delivery model would have either employer and or budget authority related to those services. So for self-directed services, you would want to review Appendix C and the various services that we have listed. In addition, you can get additional information about self-directed services in Appendix E, which is participant direction of services. Appendix E will give you an overview of the different types of supports available, including DDA, advocacy specialists, support brokers, financial management counseling services. In Appendix E, it will talk about the budget process. It'll talk about the scope of financial management counseling services and our new proposal related to additional training and orientation. I encourage you, if you're interested in more information about self-direction, to join us today for our webinar that's focused specifically on self-direction, which will begin at noon.
Thanks, Rhonda. Once community input is given between now and July 8th, when will DDA communicate back what input they have accepted, and will stakeholders have an opportunity for further discussion about the proposed changes?
Yes, that's a good question. So we will take the input that we receive, and as I mentioned earlier, we will summarize the input. It will be then incorporated into the actual waiver application and submission to CMS. We will do as we have done in previous amendments. We will update our proposals with the date of the waiver submission to CMS to reflect any changes and updates based on stakeholder input. Those changes will be posted to the same dedicated website, and it'll reflect the date, an updated date. When we receive questions from the Center for Medicare and Medicaid Services, we will engage with them with any questions. We will also post those to the dedicated website, and then the final proposals to include any updates or adjustments as per directed or guided by the Center for Medicare and Medicaid Services will also be posted to the dedicated amendment website. So in all, stakeholders will be able to see the initial proposal that we have available today. You'll get to see a second version, which will include any stakeholder input that we received and accepted. And then the third version will be the final version that we submitted with stakeholder or with the Center for Medicare and Medicaid Services updates and changes.
Is there a recording available publicly from yesterday's webinar? If so, where will it be located?
Yep, that's a great question. So Dr. Smalls, would you like to answer that one?
Sure. This recording, as well as all of the recordings from today's webinars, will be on our DDA website, as well as the DDA YouTube channel under Medicaid Waiver Amendments 2025. So you'll be able to listen to all of these recordings at your leisure. Okay. Can someone that's currently trying to switch from CSW to CPW to obtain residential services complete a revised PCP to include the need for residential services to become effective on 10/6, October 2025?
If an individual has an assessed need for residential services, we would recommend that you work with your coordinators of community services. We will need to look at that need and ensure that we have a slot available within the Community Pathways waiver to support that enrollment. If there is a slot available, then we will be able to move forward with the waiver application process. And this is what we're trying to address by consolidating. Currently, that individual will need to complete a new Medicaid waiver application, create a new initial person-centered plan reflecting the need for residential services, and go through the entire process to include completing a document to demonstrate that they choose to disenroll from their current community supports waiver and are seeking to enroll in the community pathways waiver. With our proposal and the consolidation of the waiver programs in the future, only a revised PCP or person-centered plan will be needed. The waiver application process of disenrollment and enrollment would no longer be needed.
Thanks, Rhonda. For community living group homes with overnight to be approved, does the person need to justify that they need awake overnight staff or just overnight supervision?
For overnight supports, as we are proposing, the overnight supports would need to be provided by an awake and alert staff. So an assessed need for overnight supports would need to be demonstrated. And the proposal would be that the requirement would be staff to be awake and alert, providing those supports.
Thank you. What role, if any, did the Waiver Advisory Council play in the development of this vast waiver amendment, and when?
Yeah, great question. The Waiver Advisory Council began its work in October of 2024, and we immediately established a waiver recommendation work group that has been meeting and sharing information with the Waiver Advisory Council and DDA related to proposed changes and recommendations. They continue to meet and look at recommendations. As we shared today, our proposals are reflecting the requirements from the fiscal year 2026 budget bill and the Budget Reconciliation and Finance Act, and also some of the program challenges that we seek to address and streamline with the consolidation.
Okay, next question. When will the final amendment be available in writing?
The final amendment will be available in its entirety once we receive approval from the Center for Medicare and Medicaid Services. And once we receive that, we will post it on our dedicated website as we currently have. It will also be available on the Center for Medicare and Medicaid Services website so that everybody can see the final approved program after submission and review and discussions with the federal government.
Will these amendments be changed at all after the community stakeholder comments? Do our comments have any impact?
Absolutely. We review all stakeholder comments and incorporate comments into our proposals. As I've shared, we will then post them on our webpage so that you can see the comments and additional information that was accepted.
I'm just moving through some of the questions that have already been answered. So give me just a second. Let's see.
Yeah, thank you for submitting. We're getting lots of questions coming in, so please bear with us as we go through them in the platform.
Is there any way, excuse me, let's see. Are there any services for individuals who were left at a hospital when the family no longer was willing to provide services to the individual?
Yeah, we have a variety of services and supports that can support individuals in different situations. The situation that you're describing sounds like an emergency situation. In that case, we would, support the individual with the eligibility determination process, the waiver application process, and if there were no viable options, then they could be supported with residential supports, meaningful day supports, et cetera, based on their assessed needs.
Did you say that in addition to 4 quarterly monitoring visits, there will be monitoring visits from the DDA regional office staff?
Yeah, based on incidents and complaints that are received, there may be additional safeguards and monitoring and follow-up to support the individual. So that would include our regional office nurses if we're starting to see changes or health-related incidents and concerns. It could be related to our quality enhancement staff, related to concerns, incidents and complaints, things that may be going on in the Meaningful Day program, the residential program, or in the community or in their own home. And then the Office of Healthcare Quality, which currently reviews, investigates critical incidents as per our policy on reportable incidents and investigations.
Thank you. For community living group homes with overnight, will the requirement that staff be awake and alert be effective on October 6th or at the time of the person's PCP renewal?
It would be effective October 6th.
Okay. For community living group home with overnight to be approved, I'm sorry, I think I've already asked that one. What is the process to approve or deny community comments?
Yeah, we will, all community comments that are received, as we noted, to the dedicated email address through the, or anything that's mailed. We also consider conversations and interactions we have with participants and families, coordinators of community services, financial management, counseling service providers, advocacy groups that we meet with, the Waiver Advisory Council. So we consider all that information that we receive in discussions and review that. That would then be shared with the Deputy Secretary for consideration and incorporation into the proposals.
Okay. When should providers revise their PCPs to include community support waiver program?
Yeah, providers can revise their program service plan to include community supports waiver program. They can do that now if they're interested in expanding to provide supports under the community supports waiver. Please note that our proposal is to consolidate all of our services under the community pathways waiver program. So if you're a provider who is interested in providing services or expanding services, you may want to consider focusing on incorporating the community pathways waiver with your program service plan. And you can do that by reaching out to the regional office provider services director who can assist you.
This is a repeat, but I'm going to read it again just as you somewhat answered it just now. If our agency is approved to provide services to adults, how will the consolidation of the waivers affect our operations and service delivery?
Yeah, if your program service plan is to support adults, you can continue to do that. If you'd like to support children, and the DDA, please note, supports individuals of all ages, the lifespan, so children through adulthood, then you would want to update your program service plan to note that you would like to now support children. If you do not, then you would only be eligible to provide services or be considered for services for adults.
Thank you. Will active plans have to be rewritten if they have approved services which the new waiver no longer allows?
Yeah, so please note that the Community Pathways waiver is our comprehensive waiver. And by consolidating the family supports and community supports into the Community Pathways waiver, then that waiver program will have all the services. So no services will be eliminated or removed with the consolidation. In fact, individuals will be able to access the full complement of services based on assessed need and service criteria, which is outlined already within the waiver programs. So they will not be removing those services.
Are more specific criteria required for approval of dedicated 1-to-1, 2-to-1 enhanced personal supports and awake overnight clearly outlined in this amendment?
The amendment continues the current standard, which is for these enhanced services to be authorized based on a nursing care plan or behavior support plan. We have clarified that individuals new to services or with a new medical or behavioral need that does not have a nursing care plan or a behavior support plan in place yet, that we will also authorize those dedicated or enhanced supports for up to 6 months to provide time for the individual to work with professionals to establish a nursing care plan or behavior support plan.
Thank you. Can a person with community living group home overnight supports live with a person without overnight supports?
Yes, in our community living group home provider sites, if one individual has the need for overnight supports, then that indicator would be reflected in the LTSS system and would need to be reflected in the individual's person-centered plan. For the individual who does not need those supports, that should also be reflected in their person-centered plan and the provider's specific service implementation plan in terms of the scope related to the dedicated supports, the awake overnight supports, or the not need for one in the case of the individual who doesn't need it.
Thanks, Rhonda. Appendix A, Waiver Administration and Operation, Admin Structure and Stakeholder Input, states the waiver is administered day-to-day by the DDA under the oversight of the Medicaid agency. How does this administrative structure ensure accountability to the IDD community and prioritize participant choice and control?
Yeah, the Appendix A, Waiver Administration and Operations, as you shared, does provide the overview of the responsibilities and the management and oversight. The DDA operates the DDA-operated Medicaid waiver programs, meaning family supports, community supports, and community pathways waiver on behalf of Maryland Medicaid. The Office of Long-Term Services and Supports is ultimately responsible. They are within the Medicaid Director's administration, and so they oversee and monitor the program to include performance measures. They look at incidents and additional metrics, which are outlined in both Appendix A and throughout the waiver application. In addition, the Center for Medicare and Medicaid Services also oversees the program, as we shared initially, and that includes reviewing our performance measures and quality reports to gauge how we're doing with meeting the federal assurances.
Is there meaningful stakeholder participation, such as a waiver advocacy council including individuals with IDD or family members in governance and decision making? And how are their recommendations acted upon?
Yes, currently we have, as I mentioned, established the Waiver Advisory Council. Previously, we had a Quality Advisory Council, which we then updated based on new federal standards related to Medicaid and beneficiary advisory councils. So we have established the Waiver Advisory Council. We have a dedicated webpage for the Waiver Advisory Council, which includes our charter and membership. The majority of the membership is to be with people with lived experiences. We currently have representation from both service delivery models, meaning we have individuals representing the self-directed service delivery model and individuals also representing the community provider managed model, also referred to as the traditional model. The advisory council also includes family members, and we have representatives from family members in different areas of the state. It also includes representation from our coordinators of community services, financial management counseling services, a variety of advocacy organizations to include the Developmental Disabilities Council. We have representation from People on the Go. We also have representation from the Maryland Center for Developmental Disabilities Excellence, and we also have additional representation from an ethnicity advocacy group and others. So again, if you'd like additional information regarding the Waiver Advisory Council, we have a dedicated webpage. It includes our meeting dates, times. It is open to the public. You're welcome to join us. We conduct our meetings and also have public input at the end. And in addition to that, the council has a subgroup or work group specifically dedicated for people with lived experiences that is chaired and supported by the council's co-chair, Charlotte Whittaker, who is an individual with lived experiences.
Thanks, Rhonda. Will providers still renew every 3 years?
Yes, DDA licensed and certified providers will still need to renew every 3 years. And we have noted the standard within the proposals that their renewal applications must be submitted 60 days prior to the expiration, which is our current standard. So again, to be transparent, we're just, again, reflecting that in the waiver application.
Okay, next question. Since DDA is requiring training for CCSs and providers under the new waiver program, will DDA also be requiring training for the DDA PCP reviewers so that they are consistent in requesting supporting documentation, clarifications, etc.?
Yes, with the proposal, we are also have developed training strategies to include our plan reviewers at our regional office to align with the proposal changes and just for annual refresh. We will also be partnering with our coordinators of community services, our financial management counseling services. We'll be making updates to the support broker training requirements in our training series so that collectively as we move forward, we are all on the same page and aware of any changes in standards in addition to reviewing existing standards.
Thank you. Are there a specific number of slots for residential funding, and will this number increase with more people having the opportunity to request residential services under the CPW?
Yeah, so currently there are a variety of different reserved categories, which we often refer to as slots or spaces available within the 3 DDA-operated Medicaid waiver programs. Our reserved categories include areas or priority categories such as our transitioning youth, individuals transitioning from institutions such as under the Money Follows the Person program, Department of Human Services, foster care youth aging out, Maryland State Department of Education, residential school transitions or people aging out, etc. We do not have a reserved category called residential services. We would, for individuals currently today, in our current state, if they were in the community supports waiver and were in an emergency or crisis situation where they could no longer remain in their current living environment and needed residential supports, we would seek to utilize a crisis resolution slot or an emergency slot for consideration of opportunity to apply to the Community Pathways waiver. So with the consolidation, we won't need that because if you're enrolled in the waiver program and you have the assessed need for residential services and meet the service description and standards, then you would be able to be approved for that and would not need a specific slot for that.
Thank you. If a provider is currently supporting individuals with in the CSW, will they be required to make a change to CPW to comply with this amendment? If yes, how will they go about that change?
If you are currently a provider under the community supports waiver only, and you did not, when you applied to become a DDA provider, select the community pathways waiver, if you choose to continue to provide services under the DDA-Operated waiver program, you should update your provider service plan and application to reflect that you now want to support individuals under the community pathways waiver. If you need assistance, please reach out to the regional office, provider services director or team who can provide additional guidance related to adding the Community Pathways Waiver program as a program for which you would like to support.
Do renewal requirements impact self-directed service vendors and staff?
do renewal requirements. If you're referring to the provider renewal requirement, if they will not need to complete the DDA provider application renewal process if you're a direct support professional or employee under self-directed services. Vendors also would not need to complete that. We are going to be supporting our behavior support services and nursing support services sole practitioners with the process so that they can be fully incorporated.
Thank you. May a personal support DSP who is a relative or guardian under the updated definition of relative guardian provide more than 40 hours of billable support?
So under our proposal, we are looking to maintain the standard of relatives to provide up to 40 hours of billable services. Currently, we have language in there unless otherwise authorized. So we want to maintain the standard of the 40 hours. We are also proposing to allow more than 40 hours on a temporary basis based on situations such as weather-related, staff shortages, et cetera. That is reflected in Appendix C-2, and we'll be reviewing additional information related to that this afternoon at the 2:30 and also the noon webinars.
Thank you. Will there be limits on job development services?
No, job development services will continue to be an option under the employment services.
Is there a specific timeline or deadline for providers to consolidate their program under the Community Pathways Waiver?
I would recommend, if you're interested in providing supports under the Community Pathways Waiver, that you begin that process now. Remember, the consolidation would take effect October 6th. So you have, from June to October 6th to complete the process, which may include updates to the Medicaid e-prep system. So again, I encourage you to reach out to the regional office, provider services team to start that process.
Okay. Can you explain the source of each column on the first table of Appendix J, cost neutrality? More specifically, which columns show the institutional cost and which show the waiver cost? Let me know if you need me to move to another slide, Rhonda.
Yeah, we don't have information in this slide deck about cost neutrality. So in the cost neutrality for Appendix J, J will show you in the different columns the projected number of users, the average number of units being used, the rates, projected cost. In the waiver program or in the waiver application, there's also a section related to cost neutrality. And there are terms that they use or factors such as D, prime, et cetera. Happy to follow up with the individual to further discuss because it's not an easy discussion without having a slide to present on it. But if you review the waiver application, it will talk about home and community-based services versus institutional cost and the different factors for the heading of those columns.
Thanks, Rhonda. Will there be any change to required PCP documents?
The person-centered plan that is within the LTSS Maryland system is not being changed. Basically, all person-centered plans for family supports and community supports will be updated for their program type to reflect community pathways, and their currently authorized services will continue. We are looking at supporting documents to see if there's any updates that would be needed related to that. And if so, we would be sharing and communicating those additional documents.
Okay, Rhonda, I think there's so many really great questions. Some of them are repetitive. I think we answered most of the ones that are directly applicable to today's webinar. I'll keep looking in case some folks are putting some questions in at the last minute.
Okay, great. And just as you know, we're kind of wrapping up for today, just a couple reminders. Yesterday we did a large overview of the proposal, including going into each services and the applicable appendices. If you haven't already and are interested, please join us at noon for our self-direction webinar. We'll do the same kind of introduction, but then we'll focus on Appendix C for self-directed services, and then Appendix E. This afternoon at 2:30, we will also do another webinar specific to services and provider qualifications. We'll have the same or similar introduction related to the budget bill and the reasons and what we're proposing. And then we will go through Appendix C again, all the services for both service delivery models. So both the self-directed services and the community provider managed model services that we're proposing, any updates or changes, and the provider qualifications. As a reminder, our public comment period is from June 9th through July 8th. We have the dedicated website that you can look at the track change documents, and the comments can be submitted to the dedicated email address wfb.dda@maryland.gov or mailed directly to the Department of Health Federal Programs at 201 West Preston Street, 4th floor, Baltimore, Maryland, 21201. Robert, would you like to add anything to close out?
Well, thank you, Rhonda and Nova, for presenting on this very important topic. Just want to thank everyone for taking time out of your very busy days to join us this morning to learn more about the waiver and the input process. And want to strongly encourage that everyone take advantage of the public comment period to submit comments related to this waiver application. And I'll turn it over to you, Dr. Smalls.
Okay, well, thank you all for joining. Repeat after you, Robert. The webinar will be uploaded again to the DDA website and to our DDA YouTube channel under DDA Medicaid Waiver Amendments 2025. And I know additional communication will go out to make sure that you have links to all of these recorded webinars. Thank you so much for joining us today. Hopefully you'll be able to join us for the remainder sessions of the day. Take care. Bye-bye.